So this is the first of a series of videos from chapter 19, the heart. So the heart and blood vessels make up the cardiovascular system, transport blood. We already talked about this when we talked about blood, but the purpose of blood is to deliver oxygen, nutrients, remove waste, carbon dioxide, etc. But what we didn't talk about was the idea of perfusion. It's about delivering blood to where it's needed at the time it's needed in the amount that it's needed. So it's in milliliters per minute per gram of tissue. And the heart needs to constantly be supplying that. And those perfusion requirements change minute by minute, second by second in tissues. Just use a skeletal muscle to scratch your nose, and more perfusion has to go to those muscles that were involved. So, arteries carry blood away from the heart, veins carry blood back to the heart. On the systemic side, arteries carry oxygenated blood. On the pulmonary side, they carry deoxygenated blood. And it's the opposite for veins. Veins systemically carry deoxygenated, and on the pulmonary side, they carry oxygenated blood from the lungs to the heart. Capillaries are the site of exchange, especially gases, nutrients, things like that. So there are capillaries in the lungs that exchange the gases between blood and the air in the lungs, and there are capillaries in all the tissues, or most tissues, to exchange between the blood and the cells of the body. If you think of arteries, systemic arteries, as supplying liquid to an area, it's like the pipes that come from the water main into your house. There's a pipe that goes to the kitchen sink, there's a pipe that goes to the dishwasher, there's a pipe that goes to the toilet, etc., etc. And so they are supplying water to those things. The drains from the sink and from the toilet and everything all come back. Those are like the veins. The capillaries are like the appliance. It's like the sink or the shower or the dishwasher, whatever. It's where we actually use the water. It's the same here. Capillaries are the organs of exchange. So if we look at it, this is an overall picture. We'll go into it deeper in the next section. So when we look at the heart, there's really 4 chambers. 2 of them are called atria, and they're the receiving chamber, and 2 of them are called ventricles, and they're the pumping chambers. And really what we have is 2 side-by-side pumps that are pushing a circuit. So you'll notice that when we talk about the heart, we talk about the right side, which has got the blue deoxygenated blood in it, and the left side, which has got the red oxygenated blood in it. Something to note that almost every picture you will see in the book, it's the right side of the heart, the person's heart, the dead guy's heart, not your right. So be very careful. Usually when you're looking at pictures of the heart, the right side is on the left side of the page. Now there are things called great vessels. There are the vena cava, superior and inferior vena cava, bringing blood from the body to the heart. There are the pulmonary veins that bring blood from the lungs to the heart, and those are right here. There's 4 of them, and you'll notice they're red because they carry oxygenated blood. There's the pulmonary trunk and the pulmonary arteries that take blood from the heart to the lungs, and there's the aorta, which is the main artery that supplies blood to the body. There's a series of valves. We'll talk about them in a minute, but each ventricle has 2 valves, one inlet valve and one outlet valve. We call the ones between the atria and the ventricles the AV valves, a right and a left one, and the ones for the great vessels going to the aorta or the pulmonary trunk are called the semilunar valves. So we talk about pulmonary circulation as the deoxygenated blood leaving the heart from the right side of the heart, going to the lungs, dropping off carbon dioxide, picking up oxygen, and returning to the left side of the heart as oxygenated blood. That's one circuit. On the systemic side, oxygenated blood leaves the left side of the heart via the aorta, goes to all kinds of cells everywhere in the body where there's an exchange of gases, nutrients, and wastes, and then the blood returns via the vena cava to the right side of the heart. So this is the circuits. You'll notice, so this is the right atrium. Right atrium takes blood from the superior and the inferior vena cava. The inferior vena cava takes all the blood from below the diaphragm. So all the blood in your body below your diaphragm returns to the heart via the inferior vena cava. Everything from above the diaphragm returns by the superior vena cava. So your arms and your head and everything, your chest, all comes this way. It passes from the right atrium through the AV valve, which happens to be called the tricuspid valve, gets pushed by the heart out the pulmonary trunk. Now, the trunk is what we call a short artery that immediately branches into 2 or 3. It goes to 2 or 3 different places. So this is the pulmonary trunk that goes into the left and right pulmonary arteries, which go to the lungs. Gas exchange happens at the capillaries. It comes back via the pulmonary veins, all 4 of them, into the left atrium. From the left atrium, it passes through the mitral valve, the AV valve, into the left ventricle. From the left ventricle, out through the aortic semilunar valve, and then on the systemic circuit back to the vena cava. Okay, so the heart is found in the middle of your thorax in an area called the mediastinum. It's an area that's found between the lungs, behind the sternum, in front of the spine. The heart itself is about the size of a clenched fist, so it's not as big an organ as you maybe envision. You'll notice that in this picture there's the diaphragm. The heart sits on the diaphragm, so it fills that whole space quite nicely. The heart itself sits in this bag, a protective bag, really. It's called the pericardium. Peri means around, cardium means heart, so the area around the heart. The pericardium is made up of a couple of different parts. The outside of it is a dense, irregular connective tissue called the fibrous pericardium. Now, the fibrous pericardium completely surrounds the heart. It attaches to the diaphragm below the heart, and it also attaches to the aorta, pulmonary trunk, vena cava, like all of the great vessels. What it does is it protects the heart. It holds it in place. It keeps it separate from other organs or anything that's in that thoracic space. But it also acts as a check on overfilling. If too much blood returns to the heart will expand, and it will basically fill this rigid, like, pericardium, fibrous pericardium, and will not be able to expand any further. So it's like it prevents the heart from actually damaging itself by overfilling. Now, lining the fibrous pericardium is the serous pericardium. And the serous pericardium is an epithelial membrane. It is a simple squamous epithelium and some areolar connective tissue that attaches it to the fibrous pericardium. And it's got a lot of blood vessels in it. And it produces a liquid that bathes the outside of the heart. Now, it comes in two layers. There's the layer that's attached to the fibrous pericardium, which is called the parietal layer, and there's a layer that's actually attached to the surface of the heart, and that's called the visceral layer. Now, moving forward, all the organs that are found in the abdominal, thoracic, and pelvic cavities have this exact same thing. They have a serous membrane that surrounds the organ and lines the cavity that the organ is in. And always the part that's attached to the body wall, to the outside, is called the parietal part, and the part that's attached to the organ is called the visceral part. So in the case of the lungs, this serous membrane is called the pleura. There's a parietal pleura that attaches to the ribs, and there's a visceral pleura that attaches to the lungs. In your intestines, it's called the peritoneum. The parietal peritoneum is attached to the body wall, and the visceral peritoneum is attached to the intestines. If any of you have ever cleaned fish, you know exactly what the serous membrane looks like. It's that slippery, shiny, very thin layer that lines the cavity and holds all of the, for lack of a better word, the guts together. And in between the two layers is a space, and in this case it's called the pericardial space because it's the space in the pericardium, and it's filled with pericardial fluid, which is made by the serous membrane. Now, the pericardial fluid cushions and protects that way. It reduces friction, so when the heart's beating, it doesn't rub on anything. And there's a certain amount of oxygen and nutrients in it as well. We are constantly making serous fluid, and we're constantly reabsorbing it. It's very much like we saw in joints with the synovial membrane. So when we look at it, you can see that the fibrous pericardium is attached to the great vessels here and to the diaphragm here, and it surrounds the entire heart. The small blow up here there's the fibrous pericardium here. This is the parietal layer of the visceral pericardium, or of the serous pericardium. This is the visceral layer. And in between is the pericardial space, pericardial cavity. filled with fluid. Now, the visceral layer, because it really forms the outer layer of the heart wall, is often called the epicardium. These two names are interchangeable. The muscular layer here, all of this, is called the myocardium, which means muscle heart. And then there is a simple squamous epithelial layer here on the inside lining the chambers, and that's called the endocardium. Endo means inside, so inside the heart, myocardium, muscle of heart, epicardium on the heart, pericardium around the heart. Now, we've already kind of established that the left side pumps the systemic circuit. The distance between your heart and your toes and your fingertips and is quite a ways. There's a lot of blood has to be moved a long way against resistance. So it takes a fair amount of pressure. The right side only has to pump to the lungs, and the distance from your heart to your lungs is what? Maybe 4 or 5 inches. It's not very far at all. So it's under low pressure because it doesn't have a lot of resistance. So the thickness of the walls of the right ventricle, because they don't have to produce as much pressure, are much thinner. On the left side, the walls are very, very thick. Now, in this picture, it's deceiving. It looks like the lumen, the space for blood, on the left side is much smaller than the space for blood on the right side. It's not true. The left side's longer and more symmetrical. This tapers very sharply here. There's the exact same amount of blood in each side of the heart at any given time. If there wasn't, then one side of the heart would be pumping more blood than the other, and because it's a circuit, it would go out of balance. So if the left side starts pumping more, then more comes back to the right side, and so the right side has more to pump. If the left side pumps a little bit less, say there's some sort of damage to the heart and it's pumping less blood, then less blood comes to the right side, and so there's less for the right side to pump. It balances out automatically, and the same goes for the right to the left. So this is all about pressure, not about volume. Left side much thicker. So I've already mentioned this. The epicardium is the visceral layer of the serous pericardium. It's the outermost layer of the wall. It's a simple squamous epithelium with some connective tissue to support it. Myocardium is muscle heart. It's the thickest part. It contains the cardiac muscle tissue that generates the force. Endocardium is a simple squamous epithelium with some areolar connective tissue. It lines the chambers within the heart. It basically just keeps them waterproof, and there's some physiological functions where it prevents clots from forming and things like that. It's involved with that. Now, the entire circuit is lined with the same tissue. In the heart, it's called endocardium. In the blood vessels, it continues into the endothelium of the blood vessels. The same tissue, just different names. So this is a cross-section, the myocardium muscle, cardiac muscle. Lots of blood vessels because it is very metabolically active. Excuse me. The epicardium is the simple squamous epithelium with some areolar connective tissue. The endocardium, simple squamous with some areolar connective tissue. The names are self-explanatory. Peri, around, epi, on, myo, muscle, endo, inside. If, for instance, there is a multiple choice question that says, which layer of the heart wall contains cardiac muscle cells? Pericardium, epicardium, myocardium, or endocardium? The answer will be C, muscle. If it's which one is found inside, it'll be endo, inside. The names are self-explanatory. Okay, so the atrium, the right atrium, left atria, are the receiving chambers. In a building, the hallway that you walk into when you come in the front doors is called the atrium. Most office buildings and such have an atrium. It is the receiving chamber. The two atria are separated by a muscular wall called the septum. Because it's between the two atrium, it's the interatrial septum. It separates the left and the right atrium. The two ventricles are separated by a septum as well, called the interventricular septum. And that separates left from right. So, the right atrium, as we've already said, takes blood from the superior vena cava, from the inferior vena cava, and from a place called the coronary sinus. And this is from the heart itself, from the blood vessels that nourish the heart, the coronary arteries. All the coronary veins drain back to this collecting chamber called the coronary sinus, which dumps into the right atrium. So all three of these things are carrying deoxygenated systemic circulation blood. The blood enters the right atrium and it leaves the right atrium to go into the right ventricle. And to do that, it goes through a valve called the right AV valve, which is also called the tricuspid valve. It's called the tricuspid because there are three cusps. As a student, my mnemonic to remember this for myself, and I still use it every time I talk about this stuff, is you always try to be right. The right is the tricuspid. So blood will then enter into the right ventricle, and then from the right ventricle, it pushes out through the pulmonary semilunar valve into the pulmonary trunk, and then into the left and right pulmonary arteries to go to the heart, or to the lungs. The blood goes through the capillaries of the lungs, makes its exchange, comes back through the pulmonary veins, oxygenated, and dumps into the left atrium. It's received into the heart in the left atrium. The blood then leaves the left atrium and passes through a valve into the left ventricle. This valve on the left is a very important valve clinically because it takes the most pressure of all the four valves in the heart. It's called the mitral valve. It's also an acceptable name to call it the bicuspid valve because it has two cusps. But 99% of the time you will hear it referred to as the mitral valve. When the blood gets into the left ventricle, it exits through the aortic semilunar valve and goes into the aorta and then is distributed to everywhere in the body through the systemic circuit. So this is the right atrium here. The superior vena cava, the inferior vena cava, this is the opening for the coronary sinus. Now this spot right here on the interatrial septum is called the fossa ovalis, the oval depression. In the fetal heart, we don't send blood to the lungs because a fetus isn't breathing. It gets its oxygen through the placenta. So we don't bother sending very much blood to the lungs here from the right ventricle. Instead, it passes right from the right atrium through a hole that's right here with a flap on it that's called the foramen ovalis. And it goes right into the left atrium where it goes to the left ventricle, out the aorta here, around, eventually through the placenta, and comes back via the vena cava. And so this space allows that circuit fetally. As soon as the baby takes a breath, the pressure in the lungs goes way down, which then makes it desirable for the blood to go to the lungs. The little flap closes here and seals. Now, there are some people where it doesn't make a complete seal and they can have a hole through there. Any blood in fetally that doesn't go this way ends up going here to the right ventricle, out the pulmonary trunk, and usually straight through an anastomosis, an artery that goes from here, the pulmonary trunk, to here in the aorta, and it mixes with the blood coming out of the left ventricle. This is called the I just lost the name of it, but fetally it's a bypass. Again, when the baby is born, this bypass shuts down, and the remnants of it is called the ligamentum arteriosa. It basically turns into a ligament that holds the aorta and the pulmonary trunk together. Next year in pathology, when we're looking at congenital heart defects, that's going to come into play. So the lining of both atria here have got these little ridges that looks like you've taken a comb and run it through the tissue. So they're called the pectinate muscles. What their job is to give a little bit more muscular strength to the walls of the atria without taking up too much space for blood. It's kind of a rough surface. Now the blood accumulates here and then pours passively through here into the ventricle. Now the ventricle has the same sort of thing here. The walls have got these ridges of muscle tissue extending out to increase the strength without taking up the minimal amount of room that would be normally occupied by blood. These are much larger, and they're called the trabeculae carnae. Trabecula means walls, carne means meat, as in chili con carne, peppers with meat. Carnivore, meat eaters. Trabecula carnae. There are some specialized outcroppings of these trabecula carnae. On this side there's 3 fundamentally. Sometimes there's 4, but usually there's 3, and these are called the papillary muscles. The papillary muscles. On the left side, there's 2, because there's 2 cusps, bicuspid, 2, tricuspid, 3. These papillary muscles attach to the valve via these tendinous cords called the chordae tendini. See them here. These are the heartstrings. And when we get to how the valves function, we will talk about them. But these are basically collagen fibers that strengthen the valve when the valve is closed. So the blood arrives here, flows through this valve into here. This contracts, which increases the pressure, which makes this valve close, the tricuspid valve close, and it pushes blood up here. When the pressure is higher than the pressure in the pulmonary trunk, this valve opens and blood goes into the pulmonary trunk all the way to the lungs. It passes through the lungs, comes back by the pulmonary veins into the left atrium, where it passes passively through the mitral bicuspid valve into the left ventricle. When the ventricle squeezes, pressure goes up, closes this valve, and then pushes this valve open, which then pushes blood into the aorta, and it goes everywhere in the body. There are 4 valves. Now, the point of the valves is for one-way flow. If any of you have ever worked in a restaurant as a server, you will know that most restaurants have got 2 doors going to and from the kitchen, and they open in opposite directions, so that the waitstaff goes in, pushing open a door to pick up their orders, and they leave via a different door, which opens the other way, and they just push that open so that they can take their orders to the dining room. It makes everybody flow in one direction. It stops people from bumping into each other, etc., etc. The valves in the heart do the exact same thing. The 2 valves that go from the atria to the ventricles, the tricuspid on the right and the mitral on the left, flow into the ventricles, allow flow into the ventricles, but not out. And the semilunar valves, the pulmonary and aortic semilunar valves, on the right and left respectively, allow blood to flow out of the ventricles, but not back into the ventricles from the aorta and the pulmonary trunk. Because you don't want it to backflow. The AV valves I've just talked about, they close when the ventricles contract. Now, you can imagine that the pressure on these valves gets very high because the ventricles are contracting with enough force to push blood everywhere in the body, especially on the left side. And these cusps, these little flaps on the valves, are very thin. They fill up with blood like a parachute, and there's a possibility that they could blow through backwards. So we have all of these chordae tendini, the tendinous cords, that tighten and prevent the prolapse, the inverting of the flaps back into the atrium. There are various conditions that can cause this to fail, and that will call then for valve replacement surgery. So the semilunar valves, they open when the ventricles are contracting, and they close when the ventricles are relaxing. So they each have 3 cusps, pulmonary and aortic. Again, the picture self-explanatory. Tricuspid, mitral, aortic semilunar, pulmonary semilunar. There was an upcoming slide, but I'd rather talk about it right now. When the valves open, they open silently. It's like opening a door. It's silent. When the heart muscle contracts, it's silent. You don't hear muscle contracting. If you put your biceps next to your ear and flex your elbow, you won't hear the muscle. If you slam a door, you get a noise. That's when the noise happens, is when the valves close. So the typical heartbeat sounds that you hear are the closure of these four valves. It's lub-dub, lub-dub, lub-dub. The first sound is the two AV valves closing. So blood, it goes into the ventricle starts to contract, the pressure goes up, which then slams the mitral valve and the tricuspid valve closed. And you get, then the semilunar valves open, blood is ejected through the semilunar valves into the great vessels, and then when the ventricles start to relax and the pressure drops, the pressure in the aorta is fairly high, so it closes first. The aortic semilunar valve closes first, and then very shortly thereafter, the pulmonary semilunar valve closes. So what you get is and the sound is longer. That's why the two sounds are slightly different. Lub-dub, lub-dub. So I'm going to end this video here, and we'll pick up in the next video.